Hi, I'm Maddie. I'm going to be palpating you today. Is it okay if I touch you?
Yes.
Okay, I'm going to have you lay on your stomach to start. And then first, I'm going to do your superior nuchal line. You're going to find the external occipital protuberance, and then it's going to be on each side of that, so right about here. And then I'm going to do your C5 spinous process in your cervical. So here is C7, and then I'm gonna go up one, here's the gap, and then C6, up one more is the gap, and then C5 right here is the spinous process. If I go up one more, there's the gap, and then C4, and then I go lateral, and right here is the transverse process of your C4. And then the first rib is gonna be, so C7, I come over lateral, and right here above the spine of the scap and superior border of the scapula is the first rib, deep in there. And then the spinous process of T2 is gonna be down, so here's C7, I walk down, here's a gap, T1, and then the gap again, and then here's T2, the spinous process of that. Okay, now I'm gonna look at your longissmus. Is it okay if I pull this down a little bit?
Yes.
Okay, so it's gonna be down here in the lumbar portion. I'm gonna have you extend your back, so lift it up a little bit off the table, and it's right here. You can feel it activate. Okay, so now I'm gonna have you lay on your side. It doesn't matter which side. And we're gonna find your glute med. So I'm gonna have you lift this leg up, but keep your knees straight, and I'm gonna go right here, if that's okay.
Mm-hmm.
Okay, so lift this leg up. Good, I can feel it right there on the side. Perfect. Okay, so now you can lay on your back, and I'll have you come up a little bit so your head's hanging off, and I'll hold it, and you can just relax your head in here to relax your trap, and I can feel your rectus capitis posterior minor. It's gonna be the medial border of your suboccipital triangle right there. Okay, you can scoot back up a little bit so your head's supported. And then next I'm gonna do your ASIS, which is right here on the front. You can feel these bony prominences right here. That's your ASIS. And then next is your greater trochanter. So it's gonna be lateral, and I'm gonna pull this up a little bit. And it's gonna be the bony prominence in here, in your hip, on your femur. And then next one is the belly of your rectus femoris. So I'll have you extend your leg, lift it up against me. Yep, right here, it's the middle one. You can feel it right there. And then next is your sternocleidomastoid. So I'll have you look to your right, and you can see it right here really well. Right there is your sternocleidomastoid. And then the next one is the inferior pole of your patella. So here's your patella right here. It's gonna be down here on the inferior side, also called the apex, right there. And then next is gonna be your fibular head. And then that's gonna be lateral. So here's part of your tibia, and you'll go even farther over, and down here is the fibular head, right there. And then next is your external abdominal oblique. Okay, so I'm gonna pull this down a little bit, and it's gonna be like hands in your pocket. So right here, so I'll have you twist to your left. Perfect, and then you can feel that activate right there with the rotating to the opposite side. Perfect. And then next is gonna be the belly of the fibularis longus. I'll have you scoot up just a little so your foot's not at the pillow. Okay, so now I'll have you push against my foot, evert, and you can feel the belly of that right here on the lateral side. And then next is gonna be the medial malleolus. So you can see it on this ankle right here on the medial side, that bony prominence. Okay, so now we're gonna do the anterior talofibular ligament on the lateral side from the talus to the fibula down here. So it's gonna be right in here so you can feel it. And then next is your navicular tuberosity, which is on your medial side. It's closer to the medial malleolus up here. Right here, it's that bony prominence. And then the last one is gonna be the first metatarsal phalange joint right here. Comes from the metatarsal, and then the phalanges up here, so it's gonna be right here.